Internal displacement in Nigeria has been driven over the past few decades by coup, internal armed conflicts, generalized violence, and natural disaster. Currently, the insurgency by Boko Haram has been the major cause of displacement after the Nigerian Civil War of 1967 to 1970. Statistics reveals that there are about 2.5 million internally displaced persons in the country who have sought refuge either outside the country or in different parts of the country. The Federal Capital Territory has over 18 internally displaced persons camps, with not less than 2,000 persons living in each. Some of the IDPs living at the camps are either artisans, taxi drivers, or Okada riders, while the women are mostly petty traders. The IDPs are said to be the most vulnerable in the society because so many of them struggle daily to access water, food, sanitation, and proper healthcare system. On the 29th of March 2020, President Muhammadu Buhari addressed the country on the coronavirus pandemic, also referred to as COVID-19, and measures being put in place to contain its spread, including a lockdown approach in which residents of Lagos, Ogun, and FCT had to comply with the hashtag stay at home, hashtag stay safe. In addition, the federal government promised to provide the most vulnerable in the society with palliatives. Radio Nigeria visited some IDP camps in the FCT to know the level of awareness palliative received, level of compliance with preventive measures and challenges faced by the IDPs. 11-year-old Matthew Abraham and Theresa Ayuba of Miyetu village of Apowaru simply described coronavirus as
a disease from dangerous animals.
We have these things from the animal, from the dog. And the reason why we have these things from the dog is that our people, some of our women went outside to go and mess up.
The coordinator of IDPs in the FCT, Malang Idris Ibrahim Halilu of Durumi IDP camp, says,
as far as awareness or sensitization of the Abuja-based IDPs, not only Durumi IDP, is concerned, and it is nothing to write home about. It's zero. As far as the Federal Ministry of Humanitarian Affairs and Disaster Management and Social Development, which is starting with a lot of responsibility at this point in time, we want to say that it is zero. None of the officials has reached out to us. None of the officials of the Commission for Refugees, Migrants and IDPs has reached out. And none from the Office of the Secretary to the Government of the Federation that supervises the intervention agencies. NEMA had not reached out to us. FEMA has not reached out to us. Then who do we expect? Neither the FCT minister, who is the grand landlord of the country.
Despite the lack of awareness by relevant authorities, IDPs at Durumi camp have been able to sensitize themselves.
We make sure that we sensitize our own families, our friends, our neighbors, IDPs, and the host community.
According to the chairman, New Kuchinguru IDP camp, Mr. Philip Emmanuel, they were sensitized on how to wash their hands and provided with liquid soap.
Coronavirus gaskiya ba wani abin da muka shirya akai. Mu ga wani abin da ko gwamnati ta zo ta yi ko mana magana akan ga yanda ya kamata ga abin da yake faruwa. In ba yanzu da ma kenan wayannan mutane FEMA sun zo sun dauko wannan bokati da liquid soap da suka ce wai a rinka wanke hannu ne da shi ba. Babu wani abu.
Radio Nigeria, however, met with Mrs. Ann Anaje of FCT Emergency Management Agency, FEMA, at the New Kuchinguru IDP camp.
The challenges we see that experiencing is, first of all, lack of awareness. That is why we came to this settlement. They lack the awareness, so we've come here now and created the awareness that there's something like coronavirus, and we've given them soap and water. so that they can wash their hands regularly.
Also, the National Public Relation Officer of IDP camps in Abuja, Malan Chakule Lawal of Malaysia IDP camps said, although FEMA provided them with liquid soap, this has not been put to use.
People from Nema, they came here, they provide 2 buckets for us, one with the soap, then the other one is empty. They just brought it. They didn't even show us how to do it, because when they brought it, they just dump it. They said they're in a hurry, they are going to somewhere, they are going to some other camps. We drop it here, and I tell my people that they should use this soap and water for sanitizer. They say they are not sure of the soap.
Aside from the lack of awareness from the relevant authorities, what palliatives have they received?
As it is now, no food has come in, no medication has come in, no sanitizer from any quarters. So it's unfortunate that none of the over 18 camps of the IDPs in Abuja has received such gestures.
How have they been faring in the last few days, and what is the level of compliance? The coordinator IDPs Abuja.
One hotel came in and they brought in food items. There was one family like that came in, and there was the Deputy Inspector General of Police family. His wife came in, brought eggs and other food items too, which we appreciated.
Malan Chakule Lawal expressed dissatisfaction with the level of government's attention towards the IDPs, especially in recent times.
We cannot fight with government, but honestly speaking, what government did is very bad for us. If we didn't see government bring food items to our people in the various camps, we are deciding to go out and protect, because we cannot run from coronavirus, and hungry is disturbing people or killing people in the camp.
One of the preventive measures of COVID-19 is social distancing. What are the health implications of having not less than 2,000 people living in a crowded place? Dr. Fatima Halilu of University Health Services, Federal University of Technology, Minna, tells us more.
Government to a large extent should be very cautious and try to take precautionary steps. You could go ahead to expand the safety, make these people realize the need for them to maintain this social distancing. If we make the mistake of allowing this virus get in there to meet these people, it's going to be very devastating. We are having people who ordinarily maybe are not even well nourished, so definitely maybe their immunity is even already compromised. And even the environment where they are in is not hygienic. Their level of education is also not too high. There is a lot of work and there is a lot of danger.
Gwamna Yakubu of New Kuchingoro, who lives in a shack, says he wants to go home.
Therefore, inside this room, we sleep. The room is too small for us. My big problem about the food and the water. I want me to help us go back to our village. For this place, I don't get mama, I don't get father, I don't get body to help me. Now one woman for that place. I him come, give me money, I come to my room for you.
In this vein, the coordinator of FCT IDPs, Malang Idris Halilu, urged the federal government and relevant stakeholders to come to their aid to alleviate their sufferings.
I want to appeal to His Excellency, President Muhammad Buhari, even if the whole nation is his own constituency. I want to believe that he knows about the peoples of concern, POCs, such as we, IDPs. We talk about the aged group. We talk about the widows, the orphans, orphanages. And I want to appeal to the future Assured project of Her Excellency, Hajia Aisha Muhammad Buhari. She is the mother of the nation. Her future Assured project should now awake. The future has arrived. The Minister of Humanitarian Affairs, Hajia Sadia Umar Farouk, and let them act within the next 12 hours, not 24 hours, because a hungry man is an angry man. So the case for IDPs, before even the lockdown, has been very, very, very bad.
It is in the belief of the IDPs that their stay in such pitiable circumstances will not turn from a short-term relief to a lasting home place. In Abuja, Zainab Khalil for Radio Nigeria.